In my first few days as a medical student, I kept seeing this slogan, connected with health, entrusted with life. It was on the door of my dormitory, in the orientation video, and in almost every program attributed to medical workers. It's a constant reminder of how sacred our duties are. After all, as the angels in white, doctors are expected to create miracles and to save everyone. However, I was uncertain if I could ever live up to that expectation. How can I make life or death decisions when I know I might fail? Later, I found the answer from the legendary surgeon Wu Mengchao. When he conducted surgeries that nobody else dared to perform, people asked him whether he was afraid of making mistakes and ruining his reputation. He replied, his patients are more important than his reputation. He didn't run from the fact that there could be accidents, and still he chose to stand by his patients. To cure sometimes, to relieve often, to comfort always. This is the epitaph of the American Dr. Trudeau, which later became an instruction to medical workers worldwide. Our job is to treat the patients with our best effort, but sometimes we have to recognize our limitations. Time, money, technology, or just sheer luck. So our ideal is never to cure every patient. It is to comfort every patient. Not operating on them, but operating for them. In medical school, we were introduced to the concept of clinical reality, which is our interaction with the patients. It's about convincing them to trust us, knowing when to lie, and answering the question of, why me? It's about having compassion and giving the patients the hope to live longer and better. During the coronavirus outbreak, when Dr. Liu Kai was accompanying a critically ill patient to the CT room, he took 5 minutes in the almost wartime routine, stopped in the middle, and together in silence they watched the first sunset in weeks. He gave his patient the reason and hope to struggle for survival. Tao Yong, the ophthalmology expert, suffered a brutal attack from his patient, but he still chose to return to his job as soon as he recovered because his patients were waiting for him to restore their sight, to share hope. My father, a surgeon in orthopedics, once performed a surgery on femur intertrochanteric fracture, somewhere on the hip. He needed to put a nail inside to connect the fractured parts. It was supposed to be a common practice, but that day, the situation became complicated. The nail couldn't be positioned properly, and the several failed attempts partially shattered the bone. Though a little desperate, my father didn't lose hope, because intuitively he knew he hadn't tried everything yet. So he took an alternative with a locking plate, and within 10 minutes, he wrapped up the surgery. 3 months later, the patient could run and jump like nothing had ever happened. At moments like those, hope defined the mission of a doctor. Every day, the same ideal gives us a clear vision, empowering us to work long hours in the wards, to practice handling the scalpel, and most importantly, to have hope and to give hope. In his TED Talk, the expert cardiac surgeon Paul Fudan shared his journey to mastery. He said, mastery is about how we fight. Compassion is about why we fight. And the heart of the patient is the reason for the fight. Thank you.